Seek recognition.
I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 36, printed in Part B of House Report number 117-109, offered by Ms. Ocasio-Cortez of New York.
Pursuant to House Resolution 555, the gentlelady from New York, Ms. Ocasio-Cortez, and a member opposed each will control 5 minutes. The chair recognizes the gentlelady from New York.
Thank you, Mr. Chair. I present this amendment at the desk today because for a very long period of time, the United States has and continues to uphold obsolete and old provisions from the war on drugs. This provision specifically has for a very long period of time prevented and acted as a barricade to federal research on certain substances such as psilocybin, MDMA, and marijuana, in allowing us to research the applications and potential therapeutic applications of these drugs in the treatment of diseases such as PTSD, addiction, and depression. We are long overdue in a moment of reckoning to make sure that we not only rectify the harms from the past, but allow us to research the potential medicinal applications of these substances. And the first step in doing that is ending and taking down some of these old provisional barriers to research. I reserve my time.
The gentlelady from New York reserves. For what purpose does the gentleman from Michigan rise?
Mr. Speaker, I claim time in opposition.
The gentleman from Michigan is recognized.
I rise in opposition to the amendment. We all know mental health is a major problem in our country. According to the National Institutes of Health, approximately 50 million Americans from all walks of life suffer from a mental health issue. One such population, extremely close to my heart, are veterans. With around 20 veteran and service member suicides per day, I consider one death to be too many. The amendment before us, however, is trying to solve a problem that, frankly, just doesn't exist. There is plenty of research already being conducted featuring the use of Schedule I drugs to treat mental illness and addiction. The amendment will do nothing to change this, despite its claims to the contrary. What the amendment will actually do is repeal an existing provision that limits the use of funds to promote legalization of Schedule I drugs. The amendment also repeals a provision that specifically allows federal funds to be used to research the therapeutic uses of these substances. The stated purpose of this amendment, which is to support this research on behalf of those who suffer from critical diseases, is contradictory to the actual effect. Therefore, because of the disingenuous nature and intent of this amendment, I urge my colleagues to oppose it, and I yield back.
Does the gentleman reserve? The gentleman from Michigan reserves. The gentlelady from New York is recognized.
Briefly, I think one of the things that's important to, before I recognize my colleague, to acknowledge is that to have such a broad and vague provision in what qualifies as promotion includes research, and one could argue primarily affects scientific research to prevent us from actually having the evidence to assess these substances for what they are. And currently, much of the research that's being conducted right now is reliant on private funding or the stigma associated and fear and the chilling effect associated with having these provisions on the books, which are largely unnecessary, prevents such critical research from being funded. And I would also like to yield 2 minutes to my colleague, Representative Correa of California.
I also rise in strong support of this measure, and I also have the veterans is very near and dear to my heart. 15 years ago, I started my quest to help veterans deal with those invisible wounds that they bring back from the battlefield, PTSD and other mental issues that they bring back with them and carry with them on a day-to-day basis. As the chair of the California Veterans Affairs Committee, I held hearings, and I kept getting veterans saying, we prefer cannabis to opioid medication. We want the VA to give us cannabis. We don't want opioids. And I soon discovered that there was no medical research anywhere to determine what cannabis was good for and what it was not good for. Today, as a member of Congress, I have attempted to pass legislation year after year mandating that the VA do research, conduct research into the medical benefits of cannabis, and we've scored 0. This amendment is simple. It's about saying, let's do medical research into the benefits of cannabis and other drugs that our veterans are taking that they say are good for them. Let's not take away from our veterans the ability to have the medications they prefer. I strongly support this measure. Let's do it for our veterans. Let's do it for their welfare. Let's do it for scientific research. Please support this measure. With that, I yield.
I reserve.
New York reserves. The gentleman from Michigan is recognized.
Thank you. And, I appreciate the passion and the articulate response of my colleague. I've had the honor to serve with him, and we agree on the vulnerability of veterans. In fact, a year plus ago, when we tried to move the Improve Act through the Veterans Affairs Committee and to try to look at different ways to provide opportunities to bring veterans into the VA healthcare system so we could identify them and treat their addiction. And it wasn't about necessarily the research of the product. It was the research of the veteran as a whole, the veteran's vulnerability. And I'll tell you, it was painful in the committee setting to have the Improve Act disapproved at the time when at the same time that same committee authorized equine therapy. So as Dr. Phil Rowe said at the time, this is a first for the Veterans Affairs Committee. We have not allowed people to treat veterans, but we are allowing horses to treat veterans. The point is, we are looking to do something here via this amendment that does not solve an existing problem. We need to have the outreach, the research, but we also need to have the human side to make sure that we connect all the dots for the betterment of the veterans' mental health. And with that, I reserve.
Reserves. The gentlelady from New York is recognized.
Thank you. And with acknowledgement of that point, and I think many of us have a shared outcome and a shared goal here, which is to help people who are hurting. Right now, more than 40,000 people die in the United States of opioid overdoses annually. And at least 1 in 2 PTSD patients cannot tolerate or do not respond adequately to existing treatment. We have promising indications that certain drugs that are frankly unjustly, in my opinion, placed on the Schedule I list have promising outcomes for people who are suffering from PTSD, including our veterans. We have to have the research in order to develop these holistic, whole-person treatments. That research deserves to be in the realm of the public. That research deserves to be eligible for public funding, and a blanket, vague ban that was born out of fear and the paranoia of the war on drugs should not be defining the limits of our ability to act responsibly today. I reserve my time.
Gentlelady from New York reserves. The gentleman from Michigan is recognized.
The amendment before us, as it has been presented, is trying to solve a problem that doesn't exist as stated. There is ample research already being conducted featuring the use of Schedule I drugs to treat mental illness and addiction. The amendment, as presented, will do nothing to change this, despite the claims to the contrary. And I urge my colleagues to not support, or said a different way, to oppose the amendment, and I reserve.
The gentleman from Michigan reserves. The gentlelady from New York is recognized.
To that point, I believe that this problem does very much exist. Much of the research that's being conducted today must rely on private funding, and we cannot allow just for that to be limited in its scope. If we only allow corporations, or if we only allow well-moneyed interests and wealthy interests to have a monopoly on the ability to research these drugs, we are not acting and really fully using the resources of the public in order to determine the full benefits that could be possible. Thank you. I yield.
The woman's time has expired. The gentleman from Michigan is recognized.
Mr. Speaker, as a veteran and one who served the country for 40-plus years in uniform, the bond we have as veterans goes deeper than anything could imagine. The worst thing that can happen, as has happened in my family, is to have a loved one and a veteran take their own life. I have decades, unfortunately, of family experience in this, and because of that, my passion for stating opposition to this amendment goes unabated, and with that, I yield back.
The gentleman from Michigan yields back. The gentlelady. Pursuant to House Resolution 555, the previous question is ordered on the amendment offered by the gentlelady from New York. The question is on the amendment. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to.
What, yeas and nays?
Without objection, the motion to. Pursuant to Section 3 of House Resolution 8, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, further proceedings on this question are postponed.